past 3 years or so, we have had the COVID pandemic, which has also affected Zambia as a country. During that period, as a way of controlling it and also monitoring the pandemic, a number of sequencing facilities have been set up using next generation sequencing technology. So as a result of that, we have a number of labs which are generating this fantastic sequencing technology, of which we're using part of that information to upload to the global community and determine the variants which we have within the country. However, what has not been developed is the bioinformatics technology at large, in terms of how to make better use of these sequencing technology in disease surveillance and also in controlling a number of epidemics, seeing what future pandemics which can possibly be on the horizon. So as a result of that need, this workshop which we had was put up to cater for that dearth of capacity in sequence analysis, as well as look at the technology which needs to be put in place to support the bioinformatics for next generation sequencing.
I'm Anzan Dippenaar. I am a South African and trained in molecular biology. I studied at Stellenbosch University. Currently, I am employed as a postdoctoral scientist at the University of Antwerp, where my role is basically focused on all things NGS related. So I'm involved in a variety of projects that have its focus mostly on TB and different applications of next generation sequencing technologies in the field of TB research, both clinical and more applied to public health. I have a passion for training and capacity building. I've been teaching people bioinformatics for a long time, for almost 10 years actually. And this experience in Zambia has been really taking me back to my roots of transferring the knowledge that I've gained over 10 years to an area where that knowledge is really needed and where capacity needs to be built. And I'm really excited to have seen the lights go on for people during this week, and happy to have shared what I know with lots of people. And I'm really excited to see how those seeds that we've planted during these 2 weeks grow in the future.
My name is Kabengele Keith Siame. I am a scientific officer at the Tropical Diseases Research Center, CIDRZ, and my main responsibility as of now are setting up next generation sequencing at the institution, as well as the associated bioinformatic analysis of the sequence data we generate.
This is Abhinav Sharma. I am originally from India, but currently staying in South Africa. I've been trained in computer science, and then in my master's I started to enter this field, and I specialized in application of machine learning in drug resistance prediction in tuberculosis. And throughout this journey, I found that technology by itself is not enough to solve problems, but technology and engineering needs to kind of step out and help people do what they want, help people to make their lives easier. So this is how I entered the field of bioinformatics, and I'm really glad to be here. This is a pivotal moment, as I see, in Zambia, because the team as a whole is starting off with NGS technology and sequencing, and now during the course of this workshop, this training, we have covered a lot about how to use that data, how to make sure that data is perfect, how to use that data, and how to apply the learnings we have from that data. So it has been a very fun and I should say satisfying experience, because I started off in this field to help people, and this is as close as we get.
Bioinformatic analysis of next generation sequencing technology is a very new thing for the country as a whole, and even the staff and participants we had, very few of them had actually worked on next generation sequencing technology from the bioinformatics perspective. So what I liked about this particular activity and how the trainers had packaged it is, first and foremost, they approached it from a very basic perspective and then build up the capacity through a 10-day period. So what we and this was achieved by giving examples and, more importantly, having hands-on activities where the participants were able to work with next-generation sequencing data and give meaningful outputs in terms of transmission, disease resistance, the very things which you need in terms of controlling disease and learning more about disease in general. And in this particular instance, COVID was greatly covered. Participants were able to do the sequencing analysis, assemble the genomes, and also annotate them in the sense that they will be able to know the various lineages to which the sequences coming from the hospitals and other testing centers within Zambia can be done locally. So from that perspective, I think it's a real joy to see that we do not need to rely on external servers on the cloud out there, but that capacity, at least basic capacity, has been built within Zambia right now, whereby even if we have surges in our internet infrastructure, for example, that the information as far as COVID control is concerned, as well as tuberculosis drug resistance is concerned, the participants are able to build genomes, annotate it, and come up with the relevant lineages and disease-resistant profiles.
I think we live at a time that we do understand the value of technology and how that gets applied in diagnostics and drug resistance and also surveillance. COVID has been a tough experience for most of us, but at the same time, I would say that the age of bioinformatics has arrived now. So I think the investments that the team has made in the infrastructure is great. The investments in the sequencing is great, but this workshop enables people to use how to use that infrastructure that has been set up. And it has been a lot of hard work in setting up that infrastructure. But the journey moving forward is to understand how to use it and how to use it in a sensible way, so that this infrastructure and the management of these machines, servers, this becomes a facilitator rather than something that kind of is an obstacle for people to apply all of this knowledge.
So over the last 2 weeks, I've really enjoyed spending almost full days with the 14 or so participants in this course. And I don't think we would have had the personal interactions and the level of connection that we had if it hadn't been for this period of time, and also in this intimate setting. So I found all the participants to be extremely dedicated, and every single one came here with a passion to learn. I think what has been set up in Zambia in terms of sequencing capacity is amazing, and now having the opportunity to work with the data that these people have generated and seeing the lights go on of how they can use the data that they generate and apply it in a senseful way, making biological sense of data that looks like gibberish on the screen, but now you can make those biological connections and interpretations. I really enjoy seeing the progress that people have made over these 2 weeks, and I think that speaks to not only their dedication but their passion for the research that they're doing. And I think that this capacity building is extremely important for the future of NGS analysis in Zambia. So we realized that this massive effort of bringing people together and organizing a training session like this takes great organization, but there's also a lot of money going into this kind of training and organization. So we would like to express our word of thanks to the USAID under the TB Loan program for putting your faith in us as instructors, but also in the people of Zambia and those people on the ground to enable them to get training and to build capacity within that group and platform.
I would like to thank, first of all, the organizing committee, David, Keith, Sylvia, for making this experience very, very, very pleasurable. So I'm very happy for being a part of this project and for having this experience in Zambia. I'm far from home, but I didn't feel uncomfortable at any moment. So this is my thank you to you.
And also thank you to CIDRZ, to the CIDRZ, to the hospital for hosting us, or every single organization that was involved that made this course possible and that brought us all together. Thank you to the sequencing labs who allowed the people on the ground to attend this course, to take 2 weeks from their agenda to spend time in learning new things. I think we have to realize that these are working professionals, and having to dedicate 2 weeks of their time takes massive effort on their part. So we'd really like to express our thanks and gratitude to the participants, as well as all the organizers and individuals that made this possible. I would say from the moment I set foot on Zambian soil, I've only experienced warmth and hospitality and friendliness. So I can really say that I've been treated like royalty while I was here. I've really enjoyed my stay, from the stay at the hotel to being received by the group, by the department, by the CIDRZ, but the friendliness that we've been shown not only in person but also in email conversations, and all the hard work and everyone has really pulled through to make this a reality. I can say that this is a very hospitable country, and I'd love to be back not in a work capacity but in a more relaxed capacity where I can enjoy the hospitality and warmth of Zambian people even more.
My experience in Zambia has been very heartwarming. So small gestures, like you come and meet people, they do hello, good morning, and then this. Small gestures, I understand in some cultures they don't mean so much, but from the cultures I come from, I have been a part of, this is something very, very positive, and I really appreciate the way people have treated me, people have treated us as a whole. And like for small things, even at the hotel, whatever we ask for, people are going out of their way, out of call of duty to help us. And at TDRC, the organizing committee, the people who do our catering, they're always smiling. Everyone, like I'm really amazed. And I think this is a cultural pearl that is not well known outside of the Zambian setting. Like I would be very happy to spread the word about that cultural pearl.
None of this would have happened off the cuff. NGS technology and sequencing in general is a very new thing in Zambia. Many people don't know much about it, and to look for people who believe in the technology and are able to support it, is something which people myself in particular, have to be very thankful of. So I would just like to take this opportunity of thanking USAID through the TB loan project in terms of putting together the funds, the logistics, and making this whole activity a success. The lessons which we learned and the capacity which has been developed will go a very long way in terms of sequence technology analysis. And I really want to thank you once again, AID and TB Loan Project, because the seed you have sown, I think, is going to manifest into wonderful works, not just from the research perspective, but also in terms of having an impact on disease control and surveillance, not just for COVID, not just for TB, but for infectious diseases in general, as well as non-communicable diseases like cancer and kidney-related diseases. Thank you so much, TB Loan. Thank you, USAID.